Hi, everybody. Welcome to EXS290 Introduction to Evidence-Based Practice. I'm your instructor, Aaron Freed. I like to start off the class by asking all my students what their previous history with evidence-based practice is. Can anybody define it? Do you have any experience with it? Maybe you've heard a little bit about it in an Exercise Science 101 class, or maybe you've seen it as a topic in other areas, but usually the feedback that I get is we're going to be sitting through a research class. He's just going to make us research. I'm going to have to write papers, which there's a part of that to this course. But I really want you to understand why you're in the course. Why do we require it for our AS degree? Why does ASU require it for their degrees? Before you jump in and you start to really get involved with the process of becoming an evidence-based clinician. So my background is in healthcare. So I chose a current healthcare topic that is obviously the reason why we're doing this class online. Currently, we have a healthcare crisis in the world, and there's a lot of different debate on how we can treat our virus that's going around, COVID-19 or the current coronavirus. So the debate is centered around two antiviral drugs. One's listed on the screen. It's the hydrochloroquine drug. And then there's another medication, azathioprine, that have been used in the past to treat conditions like malaria. And we have one pocket of our community that thinks those medications should be used ASAP. And then we have another pocket that's saying, no, we need to run clinical trials. We need to make sure that they're safe. We need to make sure that they're effective. And that's really the point of evidence-based practice. So evidence-based practice takes into account three major components. Number one is research. So when medical doctors and researchers are saying we need to study these medications along with this virus to see what the outcomes are, to see what the side effects are, that's where the research part comes to into the role. It's important for us to be able to see in a controlled setting what the effects might be. What are the outcomes going to be? That is one component of being an evidence-based clinician, is to look at the research and to really care about the research. There's also a component for clinician experience. This is the argument that the other side is making right now, that we should roll out these medications as quickly as possible. They've experienced success in different parts of the world, so it's a possibility that they might be successful for this type of treatment. That's a second component of evidence-based practice. The third component is a patient preference or patient values. So is it successful for your patient? What does your patient want? And that's a part we don't hear a whole lot about, but at the same time, if you're talking with people that maybe have a COVID-19 diagnosis and are looking for a different type of treatment, this is where their values and their preferences might play a role. Should they have the option to choose whether to take this medication? Should they not have the option? Should it even be an option? I'll be honest, I don't have an answer for you. And that's the best part, I think, about a course like this. I don't have answers to a lot of these questions. What I do have is I can teach you about the processes. I can teach you about how to find the high quality research and look up high quality research. Make sure that it's high quality. Let's pick through some of the bad research. Yeah, there's plenty out there. Pick through some of the misinformation. I can teach you to value clinician experience, but not only to value clinician experience, right? We want to make sure that we're looking at both ends, but then most importantly, to also value your patient's preferences and to find out what they're concerned with, what they need, what is really important to them, which I think is a part of healthcare that we often miss. So all three of those components together can make somebody a high quality evidence-based clinician. If we're missing one of those components, then we're not really providing the highest quality care that we can for our patients or clients. I know some of you are interested in a fitness area or nutrition, speech pathology. I'm using a big polarizing example right now, but hopefully you can see my point that we need to look at all three of those areas. And like I mentioned, I don't have an answer for should we roll out medication for something that's a crisis right now. There's a lot of debate, and I can see all sides of the debate. The research clinical trial side versus clinical experience to really what would be the best for our patients. I'm interested to see where it's headed. I'm interested to see where this area of evidence-based mud, I guess, takes us, whether it's the clinician experience that's going to win out or the research that's going to win out. I don't know. And it'll be interesting to see. Often when it gets into an area of public policy or politics, it gets a little bit more muddy, obviously. So we can all look together and see how it goes throughout the term. But I wanted to just give you an example because I want you to know that, yeah, we're going to talk about research a little bit this quarter or this term. It's an important component of evidence-based practice. Like I mentioned, we need to talk about how to find high quality research. We need to take a little tour and take a little trip through our library databases, talk about specific databases that you can find high quality information. Research can be very intimidating. My goal is to make it much easier for you. There are some tricks, there are some tools that can really help you out. But also, while we're doing that, we need to keep into account that that's only one component of being a true high quality evidence-based clinician. And we need to look beyond that. A lot of what we would do in class was going to be our clinic specific, our practical application information. So you're going to get a lot of that through some videos I'm going to share with you this term, through some homework assignments. You need to make sure that you get the book for this class because you also have some reading and some quizzes that you're going to be doing, which is the typical at-home portion of the course. We're not going to spend a whole lot of time talking about that through videos or through discussions. That's going to be stuff that you're going to be able to do on your own. You'll be able to pull open your book. You're going to be able to do your quizzes every week. That's going to give you the background information for what we're going to talk about. And I hope you don't shy away when we have a discussion. There's not going to be a right answer for some of the discussions. And I hope that you take the opportunity to really push the envelope and to really start thinking about what can make me the highest quality practitioners possible, whether it's in healthcare or fitness. What can I do to be the best for my patients? And it might not be the same for all of us. So this will test you a little bit. The class will test you a little bit to make you think outside the box, but also to reimagine how your box is shaped. I think it's important for you to think a little bit more broadly, a little bit more globally, again, to provide high quality care for our patients or clients or whatever you call them, to make sure that whatever we're doing is safe, effective, and whatever we can do to the best of our ability. So this is just our first video, a little introduction for you, to give you an idea of what's to come. I'm hopefully going to be posting more very soon for you. Still working on getting the information all online, but I'll have that ready here in the next couple of weeks at the latest. I'll be communicating with you through email and through Canvas. If you have any questions, please let me know. Send me emails. Make sure you're communicating with me, and I will try to make this as smooth of a transition to an online format as possible. That's all I got now. Everybody have a good night. I will talk to you soon.